If you're planning on having hip replacement surgery, you're probably wondering, how do you get in and out of a car after the procedure? So today in this video, I'm going to be showing you the correct and safe way of how to get in and out of the car after having total hip replacement surgery. I'm Matt Segua, a doctor of physical therapy, and I've treated hundreds of patients who had total hip replacement surgery. And in this video, not only am I going to show you the safe way of how to get in and out of the car, I'm also going to talk about some common mistakes people make and a few tips of how to make this car transfer a lot easier. Okay, starting from the beginning, I'm going to pretend like I have a walker. So when we approach the car, we're using our walker. We're stepping as close as we can to the car. We're going to do some small turns so that we're facing away from the vehicle and that our back is against the car, against the vehicle. Now, just like when you try to sit down into a chair, you want to take small steps back until you feel the chair, but in this case it's going to be the car or the seat. You want to feel that car touching the back of your leg, so that tells you where you are in space. That tells you if you're in the right spot and if you're close enough to sit down, right? So when we want to enter the car, it's going to be the same process as when we're sitting to a chair. So we have the walker in front of us. What we can do at this point, instead of holding onto the walker, I can grab the actual car, whether that's the seat or if it's the car itself. Some cars have like handles that you can use. If you have handles on the sides of your car, then that's ideal. But you can also hold on to the seat itself. I have a good grip on the seat, and I can have my left hand on the actual door. From this point, it's very similar in terms of sitting into a chair. I'm gonna act like my right leg is my surgical hip. I'm gonna put that leg out in front of me, and then I'm going to use both arms and my non-surgical leg to slowly lower me down until I'm sitting. Now, at this point, I'm sitting just like I am in a chair. My car is a little on the small side, but essentially once you're in this position, you can get your head into the vehicle, and now you can adjust your hands. So I'm letting go of the side of my seat. Here, some cars have a handle on this upper portion of the interior of the vehicle. If you have that, even better. If not, there's a lot of places you can grab, like the console, the dash. You can grab onto a lot of places to help you reposition yourself. From here, this is going to be very similar to getting into a bed, but we're going to still pretend like my right leg is the surgical leg. So from this point, I'm sitting in the seat, but I want to position myself a little bit further back. So I'm going to push and scoot back. So now I'm a little bit deeper in the chair. Then at this point, I can use and this way, when you use my hands, my upper body to help lift up my leg, do small movements at a time. So this is not a fast transfer or transition. You want to make sure you do it slow and carefully. I'm going to use the outside of the car frame here, and then I'm just going to rotate my body nice and small, and I can kind of use my upper body to help assist. Now at this point, I can use still here to help get me to the edge, and then in terms of standing, it'll be the same process. You'll have someone have your walker in preparation in front of you here, and then you're going to start off with that surgical leg out in front of you. You can use the chair, you can use the door here, and then I'm just going to lean forward slightly, and then you did the transfer for in and out of the car. Now, some tips to make this car transfer a lot easier for yourself. So when you're going to perform this actual transfer, have whoever's helping you, whoever's driving, put the seat as far back as possible. They can even recline the seat a little bit too, just to make sure you have enough leg space to swing your leg in when you're doing this car transfer. So the further back it is, regardless of if it's your left or your right hip that you had the hip replacement, you just want to make sure you have ample room so it's easier for you to swing in. Because what happens if the seat is too close, let's say it's my right leg and I'm up close, then I'm going to have a hard time of trying to get past the door, and then I'm going to be very scrunched up. And depending if you whether you had an anterior or posterior approach, for example, if you had the posterior approach, now if the seat's too far up, I'm at a very significant bend in my hip. and it gets pretty close to that 90-degree precaution regarding to the posterior approach. So this is a little bit too risky and too uncomfortable. So the further back the seat is, now there's less bend of the hip. So first tip is just to make sure that the seat is as far back as possible. Another tip that will make this car transfer a lot easier, if you have multiple vehicles or at least different options of heights for your seat in the car, that will make it a lot easier or harder. So the higher the seat is, it's actually going to be a lot easier for you to perform this transfer versus my car is actually on the very low side, which for most people is going to be a much more challenging transfer, because when they try to sit down, they have to go so far down, and then in terms of coming back up, it's so much more of a distance to try to come all the way up, versus if the seat was like closer to like the level of my hips, the height of my hips, I'll be much more capable of just sitting back right here and then performing that transfer. So ideally, if you have a vehicle that's close to the level of like the bony part of your hip, that's a great seat height. Anything above the level of your waist, that gets another level of difficult as well, because if it's too low or too high, now you're facing different challenges. But if your car is relatively close to like your bone, your outside of the hip bone height, that's going to be way more ideal and a lot easier of a transfer. So if it's too low, such as mine, it's going to be a lot challenging. But if it's way above your waistline, then that's going to be a different challenge, because then at that point you may have to have some sort of step stool position so you can step up and then sit and perform that transfer. One little tip is, if you do have a car that does sit higher, what I do like to do is I'll have them park their car like right at the side of like where a curb is, and if that patient is leaving like the building and the car is right next to the curb, that positions them a little bit higher up so that they can actually be in a better position to sit, versus if it's too high, if they were just to go off of the curb and now they're on like the street and they have to try to stand like, really tiptoe their way back up, that's gonna be too challenging. So if your car is on the higher side and you have the ability to pull the car up very close to a curb, that's one way without like a little bench or a little stool that you can utilize the actual curb to help that transfer for very tall vehicles. But in general, if you can manage on getting some kind of vehicle that's like middle kind of size where it's close to the level of your hip, it'll be a lot easier of a car transfer. So a question I get asked all the time is there an easier side to actually enter and exit from? So should you be sitting on one side versus the other to make this transfer easier? And in reality, they're both going to be relatively the same in terms of difficulty, because once you get into that full sitting position, you're still going to have to assist with your upper body and lift up that leg. But it is a little bit easier if, for example, if I had my left leg, my left hip as the surgical side, if I'm sitting on the right side or if I'm on the passenger side of my car, it's going to be a little bit easier to perform this transfer if my left leg was the surgical side. So for example, I'm in the passenger side, the right side of my vehicle. I'm going to help lift up my leg, and now once I'm here, it's going to be very easy for me to lift up my non-surgical leg using my my leg and hip strength, versus if I had my right side that had the surgery. Now I'm going to have to really bring this leg up and over, and then I'm going to have to transition, and that's going to take a little bit more effort. But essentially, they're both going to be about the same difficulty. So I wouldn't say there's an easier side left versus right. They're going to be very similar.